Ready? Welcome to the first in our series of debunking myths of mental health. So today's topic is dyslexia. There are so many misconceptions about dyslexia, and it's something that we encounter every week. So the first myth that I want to talk about is that dyslexia doesn't mean that people reverse letters necessarily. It is developmentally appropriate for kids to reverse letters through about second grade, and after that we have some concerns. But they're not reversing letters because they have a vision problem. They're reversing letters because they're having trouble cementing the direction of the letters in their minds. So you often see kids who will write lots of their letters in lowercase, but then when they come to B and D, they'll make those capital letters. Another myth is that people with dyslexia aren't smart. What we've learned is that people with dyslexia are many of the smartest people in our country. About 35% of entrepreneurs and high-level executives have dyslexia or other learning disabilities. So don't discredit somebody just because they have dyslexia. Oftentimes people with dyslexia just can't read as quickly as people who don't have a learning disability in the area of reading. The third thing is dyslexia doesn't just involve reading. It can actually involve speech, so sometimes words get jumbled up like aminal and spaghetti and things like that. And oftentimes people with dyslexia have a hard time spelling because the order of the letters gets mixed up. So how do we figure out if a person has dyslexia? We look at how they read out loud. We look at how quickly, so their rate and their fluency, and we look at how accurately they read words. We also know that people have a hard time with aspects of oral language. So we look at whether kids can rhyme and whether they can hear and move around the parts in words. So we have great testing and great interventions to help people with dyslexia. So I hope that this debunked some of the myths, and in future videos we'll talk about some of the interventions and accommodations that we can use to help kids with learning difficulties.